The project I'm involved in is the You Can Ride Too program. So that's a joint initiative between the Edmonton Bicycle Commuters Society and community-based physical and occupational therapists. And our goal is to fit children with special needs with adapted bicycles so they can experience the freedom of cycling in their communities and in their neighborhoods.
Well, You Can Ride Too started over 10 years ago. Initially started as a way to teach kids having difficulty riding a two-wheel bike to learn how to ride a two-wheel bike. So that's sort of the origination of it. And then over the past probably 3 or 4 years, we've expanded the program into getting kids of all abilities to ride a bike. So that's kids who would be unable to ride a two-wheel bike, getting them to ride like an adapted bicycle or an adapted trike, so that no matter what, all kids can enjoy riding a bike.
You Can Ride Too came out from Janine Haleko, who's a physical therapist in the community. She was working with a child with special needs, and the family's goal for that child was to ride a bike. And that was their only goal at the time. They knew this little guy wanted to get going. So Janine tried a bunch of conventional tricycles and bicycles, and nothing worked for this little guy. So then she tried a higher end adapted tricycle, and this little guy got on and just took off riding. So they knew right away that it was the right bike for him. The unfortunate part is that the cost of the bike was quite significant. So for the family, it was just not reasonable to expect them to pay thousands of dollars for a bicycle their child was only going to fit in for a short period of time. So that's when the idea came up that what if we created a loan pool of different kinds of adapted bikes that children could try different bikes as they grow, and then families wouldn't have to have the financial burden of buying an adapted bike.
Success of the programs can be attributed to the collaboration between all the different stakeholders. We've got the Edmonton Bicycle Community Society, which has been a great resource for volunteers and sort of providing manpower. And then we've got physical therapists and occupational therapists who bring that knowledge about biomechanics and balance and how to help kids learn to ride a bike. So I think just the combination of having everything has really kept the two-wheel program up and healthy and running. For the adapted bike program, we have to add another stakeholder there, which is the bike mechanics, because they're the ones who do the work on modifying the bikes and repairing the bikes and doing all those other modifications that the rest of us may not have the skill set to do. So even getting more community partners involved with that has really helped to make it grow. And I think the other thing that for both the programs that have really, I think once the volunteers see what the program is, they see a child get on a bike for the first time and ride, and just that smile on their face, it just melts your heart, and you're like, I want to do this again. You just want to keep helping. Once you sort of start involved with the program, you see the joy that you're bringing for kids, and it's infectious.
Being involved in You Can Ride Too has been one of the most amazing things that I've done as a therapist, but as a parent, it also allows me to see other families just experience joy and success, and it's really powerful, and it's been